Well, Kelly Clark is Marketing and Communications Specialist with Titusville Area Hospital, and she joins us here this morning. Hi, Kelly. How are you?
I'm good. How are you doing today, Luke?
Good. Good to see you this morning.
Good to see you.
You brought in a very special guest this morning. Who'd you bring in?
I did. I brought Becca Swick with me. She is the Director of Marketing for the Site Center. She is also in charge of public education for their National Diabetes Prevention Program.
Excellent. Becca, how are you?
Hi, I'm great. Good morning.
Good to see you. Thanks for coming down with us. Tell us a little bit about yourself.
Well, as Kelly said, I'm from the Site Center of Northwest Pennsylvania. Our office is actually in Erie, PA. But a few years ago, we adopted the National Diabetes Prevention Program, which was this program actually we did not come up with. It was the result of a 20-year study by the National Institutes of Health and the CDC. Its goal is in the prevention of type 2 diabetes, which, as most of us know, it's a pretty prevalent illness in our society.
Yeah, so kind of dive into it, because obviously when somebody hears diabetes, there's a lot of things that come to mind, and obviously there's different degrees of it, so maybe you could break that down a little bit.
Sure, absolutely. Type 2 diabetes, you're going to know that you have type 2 diabetes really with a blood test. Certainly there are symptoms, but you definitely need to see your doctor on a regular basis to be screened. What we really focus on is actually the pre-diabetes, which means that you're starting to tip into that danger zone of becoming a type 2 diabetic. What you really need to do is, and I think I have an example of it here, Luke, you really need to take a pre-diabetes risk test. And it's very easy to do. This can be done in several ways. You can go on and Google diabetes risk assessment, and there are several that will pop right up for you. You can call me personally, and I can do one over the phone for you. Basically, it's about 7 or 8 questions. It asks about your activity level, your age, your ethnicity, family history, which is another big one. And those items actually kind of determine your risk factor for being a pre-diabetic.
Wow.
Yeah, and the scary thing, Luke, I will say, we are learning that 1 in 3 adult Americans is pre-diabetic right now. And 90% of those people do not know it. So what we say is, look left, look right, and one of you has pre-diabetes.
We were talking before coming on, the next 20 years is going to be it could be very scary.
Could be very scary. We're showing that if we do not do something to turn this tide of preventable type 2 diabetes, the rates of type 2 diabetes could as much as double in our nation. So we are really, we started in Erie County at the Site Center. We have several groups, cohorts, classes up and running, and we have people making miraculous changes. This program is a year-long lifestyle change program. It is, I wish I could say it was some miracle cure or something different, but it really is about small, sustainable lifestyle changes. People in the program are losing 5 to 7% of their body weight. They are becoming active. They are completing a minimum of 150 minutes of physical exercise every week. And what's great about the program is I actually started instructing it myself in January. And what's great is right here we see one of our lovely ladies. This is a difference after just 12 weeks in the program.
Wow.
It's a year-long program. The first 12 weeks is the core program, where folks are really, the main thing they're doing is they're becoming aware. This is another one of our lovely ladies. After just 12 weeks, she is 25 pounds down. And then basically, again, during the first 12 weeks, folks are keeping, it sounds really simple, but they're writing down everything that they're eating and drinking, at what time of the day. It's awareness. And people are really, they'll be tracking what they're doing, and they'll say, oh my goodness, I had no idea I was eating that or drinking that, or little things like, I didn't realize that I drink no water throughout the day. So people are making these realizations, and then they're able to make just little tweaks, little adjustments. That gentleman that you showed there, Luke, he is, I get choked up. This is just after 16 weeks. At this point, Steve is 32 pounds down, and he has continued in the program. He's still going on in the program, and he is looking forward to a 100-pound weight loss.
Really?
And he has turned.
Is that a goal he set, or is that something you guys?
That's a goal he set. You know, we go according to the research. This, as I said, this program it's evidence-based. It was built upon the research that was done for 20 years by the National Institutes of Health. And, you know, we show that even losing 5 to 7% of your body weight, wherever you are, is enough to knock your risk down by about 60% of ever developing type 2 diabetes.
Real 60%.
It's pretty miraculous.
Wow.
And the research shows, actually, if you're a little bit older, say in the Medicare age range, you do even better statistically. So people are having absolutely amazing results.
That's wonderful. Kelly, is this one of those things that maybe got overlooked during the pandemic when people were home? You know, they're
Right.
eating more, they're not taking care of themselves maybe as much.
Yes.
They're not seeing the doctor because they're waiting till maybe, you know, they're sick to do that.
Yes.
Because we know the hospital does a great job when you're actually seeing your doctor. They're
Right.
going through saying, okay, you know what, maybe you need to check this.
Yes, and also a lot of outreach programs like the one Becca does, you know, was kind of put on the side. You know, not a lot of folks were going to meetings like that, doing any sort of outreach. They were limiting their visits to anywhere, including their doctor. So yes, that did become definitely an issue. And then, you know, you were stuck at home and nobody's moving and everyone's kind of lacking in their diet. So definitely.
That stress eating, right?
Yes.
You can't control anything, so.
And actually, Kelly, I hate to interrupt, but I wanted to point out, and yes, you're exactly right. I mean, we definitely, our numbers were down. Participation was a little bit difficult and people were nervous. But each of those 3 people that I showed you, they made those successes during the pandemic.
Good.
So it can be done.
Good.
Yeah, it definitely, we were affected, but you know, we're back up and running. We are looking to bring this program into the Titusville area and the surrounding counties. The CDC has tasked us to get this program throughout Pennsylvania. So I really urge folks to get online, take a risk assessment, or give me a call at the site center. The telephone number for the site center is 814-455-0995. You can call and ask for me personally. Again, my name is Becca. I can walk you through a risk assessment. Again, if you take one online, it will show you how much at risk you are for prediabetes. And what I urge you to do is take that information to your doctor, because you are going to want to have blood drawn. The doctor can decide whether to do a fasting blood glucose, which anything over 100 is going to be questionable, and it's gonna make you know, the doctor do a little bit more examination, or they might order what we call an HbA1c, which is a pretty cool blood test. It looks back on your average blood sugars for 3 months, so that really gives you a great snapshot of how your blood sugars have been and whether or not you are in that pre-diabetic category. And if so, again, please give me a call. We are looking to get the program up and running right here in your neighborhood.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel and listening to it on the Allegheny News Talk Sports Network. And those questions are pretty cut and dry. It's not like you're trading in your car and putting, you know, your hopes and dreams into what you think the value is. Right. You know, these are pretty honest questions, so it should give you a pretty good slap in the face to make you think, okay, maybe I need to change something. Becca, before we wrap up with you, let's go back to Kelly for a second. Kelly, you've had some big events. Kind of recap what's been going on at the hospital.
Last time I saw you, we were getting ready to do our golf scramble. So we had that on May 26th. It was very successful. We had 32 teams that came out and played with us. I brought some of the pictures of our teams with us. So a lot of guys that came out, a lot of girls that came out too, to help support the hospital. We had a little bit of rain, but through it all, we ended up raising just over $31,000.
Wow!
So yes, we were very excited about that. That's all going towards our CT scanner program. We're replacing the CT unit, like I had talked with you about before, and doing some reconstruction in that area. So yeah, we're
that's
very excited to raise
wonderful.
some money for that.
Looks like a questionable bunch here, but that's okay.
I can't see which picture that is. Yeah. No, everyone that came out was great. Even though it rained, everybody was a good sport, so it was good.
That's wonderful. Everybody had a great time. And
Yeah, we had a lot of sponsors, a lot of donors that helped us out. They're all listed on our website. We had signs at the course as well, but they are all listed on our website. You can go on our website and go to Golf Scramble, and all of our 2021 sponsors and donors are listed.
Great, excellent.
Yeah.
What else is going on?
So we are having some free speech therapy and occupational therapy screenings for kids for the summer. We're trying to have it every third Thursday of the month. So coming up is actually June 17th, which is this Thursday. You can go online and schedule. It's right on our website to schedule a free screening for your kid. We also have a date on July 15th and August 19th. Like I said, you can go online and schedule those, or you can call our hospital, the 827-1851, extension 3830, or just ask for the speech department, and they will get you scheduled for your free screening. And it's really just an extra service that we're offering just to check on some kids during the summer because they're not in school. So if you think your kid might need some extra support, learning support through speech and OT, then definitely, get them scheduled.
I don't want to say anything, but you blink and we're going to be seeing the back to school commercials
Yeah.
and all that stuff.
It goes quick.
Yeah, it does. Sadly, it does.
Yeah.
Becca, again, let's hear those phone numbers. It's important to get that out there.
Yep, absolutely. Please go online, take a risk assessment, or call me personally. You can call the site center at 814-455-0995. You can call me personally at 814-403-8583. I will happily walk you through a risk assessment. And for heaven's sakes, see your doctor for regular checkups and ask about pre-diabetes. 1 in 3 American adults has pre-diabetes, and 90% of them do not know it.
Website's pretty simple. type2couldbeyou.org.
Yep, that'll work.
That'll work. And again, it seems like we're a nation that kind of reacts after the news. Here's a chance to do something before. And it doesn't take much, does it?
It doesn't. I hate to say, it's a painless program. It's delivered in a way that it's just very, pardon the pun, very digestible to make very small adjustments to your lifestyle that make a major impact and can potentially avoid a diagnosis of type 2 diabetes in your future.
Kelly, we know that Holly's been on this because instead of like cookies at Christmas, she'll do like carrots and stuff. Now, I mean, I don't know how many people are eating it, but it's a great gesture, right?
It is.
All right, so you guys have been on top of this.
Right, we're on it.
And if somebody's confused or wants more information, they can also call the hospital or talk to their doctor?
Yes, so she has been doing some outreach to the doctor's offices here. So she plans to, get in touch with doctor's office so they know about it. She was just at Oil Valley Internal Medicine. So hopefully, she'll be able to get to everyone, and they'll have all that information right at the doctor's office as well as we do. So.
Great. Kelly, great to see you this morning. Becca, thank you for coming in.
Great to see you.
Thank you
Thanks for the great
having me.
information. It's wonderful. type2couldbeyou.org. Take that quiz, get started,
Yep.
and this is something you're going to want to know.
Yes.
All right. Thanks. Take
Thanks.
care.